Canine Parvovirus, CPV, also known as parvo among pet parents, is a highly contagious viral disease that can affect dogs of all ages, but is most commonly seen in young puppies under 3 weeks of age. Parvovirus is transmitted through contact with infected feces or vomit, and parvovirus can survive in this environment for months. Parvovirus attacks rapidly dividing cells in your dog's body, causing damage to the intestines, bone marrow, and lymph nodes. Today, we'll learn more about the symptoms of parvovirus, how it's diagnosed, the treatment options available, and preventative measures you can take. Symptoms of parvovirus infection can vary greatly from dog to dog, but the most common symptoms include vomiting, diarrhea, and lethargy. The vomit and diarrhea may be bloody. Other symptoms may include fever, loss of appetite, and abdominal pain. In young puppies, parvovirus infection has a rapid onset of symptoms and can lead to severe dehydration and shock. Because young puppies are especially susceptible to the virus, it can be fatal if left untreated. In addition to typical gastrointestinal symptoms, parvovirus can affect the heart and cause a condition called myocarditis, which can cause sudden death. Symptoms of myocarditis include shortness of breath, coughing, and fainting. Diagnosing parvovirus can be difficult because the symptoms can be similar to other gastrointestinal diseases. Your veterinarian will usually start the diagnosis with a physical examination and taking a detailed history. They may also run tests such as a complete blood count, CBC, which can indicate a problem with the bone marrow if the white blood cell count is low. A fecal test may also be performed to check for viruses in the stool. In some cases, an abdominal ultrasound or X-ray may be needed to assess the extent of damage to the intestines. There is currently no cure for parvovirus, but there are several treatment options to help manage symptoms and prevent complications. The most important aspect of treatment is supportive care to provide fluids, electrolytes, and nutrition to prevent dehydration and malnutrition. In severe cases, hospitalization may be necessary to administer intravenous fluids and medications to control vomiting and diarrhea. Antibiotics may also be prescribed to prevent secondary bacterial infections. In addition to these measures, recent studies have shown that treatment with plasma transfusions containing antibodies to parvovirus can improve the survival rate of infected puppies and reduce the severity of symptoms. The best way to prevent parvovirus is by vaccination. Young puppies should be vaccinated starting at 6 to 8 weeks of age, with booster doses every 3 to 4 weeks until they are 16 weeks old. Adult dogs need a booster vaccine every year to maintain immunity. Not all vaccines are created equal, and some may provide better protection than others. A study published in 2018 found that a new vaccine containing a combination of CPV2C and CPV2B antigens provided better protection against CPV2C, the most common strain of the virus currently circulating. In addition to vaccination, it's important to practice good hygiene to prevent the spread of the virus. It's very important to disinfect the area if you've had contact with an infected puppy, and to wash your hands and body thoroughly when you're outside. Parvovirus is a serious viral disease that can cause severe symptoms and even death in puppies. If your dog is showing symptoms of the virus, it is important to seek veterinary care as soon as possible. With prompt and appropriate treatment, many dogs can recover from parvovirus. Prevention through vaccination and good hygiene is the key to protecting your dog from parvovirus. By following the recommended vaccination schedule and practicing good hygiene, owners can reduce the incidence of parvovirus infection and live a happy life with their dog. Parvovirus is a serious viral disease that can cause severe symptoms and even death in dogs. If your dog is showing symptoms of the virus, it's important to seek veterinary care as soon as possible. With prompt and appropriate treatment, your dog has a better chance of recovering from parvovirus. Prevention through vaccination and good hygiene is the key to protecting your dog from this disease. By following the recommended vaccination schedule and practicing good hygiene, pet owners can lower the incidence of parvovirus infection and keep their dogs healthy and happy. This is a highly fatal disease, so prevention is key. Thanks for watching.